Hi, my name is Dr. Dianni. In today's video, I'm going to talk to you about melasma and the two pico lasers that we have that can effectively treat melasma. Melasma is a hyperpigmented disorder that has intrinsic and extrinsic factors to it. It is often aggravated by sun damage, but there is definitely a hormonal component to it as well. Melasma quite often has an even distribution on the face. It quite often symmetrically appears on people's forehead, cheeks, and around the mouth. So PicoSure and PicoWay lasers are the most advanced pigmentation removal systems. While PicoSure is primarily an Alexandra laser that's indicated for skin types 1 to 3, PicoWay is newer and it can be used to treat all skin types, including darker skin types. Unlike conventional Q-switched nanosecond lasers, Pico lasers use a mechanical force to chop up pigments. Therefore, it is a lot safer in terms of how much heat the skin gets and therefore risks of pigmentation from these procedures themselves. The Pico laser treatment for melasma and other pigmented disorders takes half an hour on average. Once you've had the treatment, you can experience temporary darkening in the skin, but that's followed up by clearing of the pigmentation and the eventual removal of the pigments. Pico lasers are to date the fastest lasers. Unlike conventional Q-switched nanosecond lasers, which heat up the pigment and cause collateral damage to the skin, Pico lasers use a mechanical force to chop up the pigments. Therefore, it is very safe in terms of pigmentation risks because it doesn't produce a lot of heat in the skin. On average, people will require about 3 sessions to clear up pigmentation. We recommend 3 sessions to start with, 4 to 6 weeks apart. Pico lasers are both highly effective and safe for melasma removal. The reason it is highly effective is because it uses a mechanical force to chop up pigments, which is a lot faster compared to conventional lasers. Pico lasers are also safer compared to conventional Q-switch lasers because it causes less heat in the skin and therefore minimizes collateral damage and risks of hyperpigmentation from the procedures themselves. At Pulse Light Clinic, we take a very holistic approach to melasma treatment. Sometimes, if needed, we prescribe topical depigmentation creams to help maintain results and enhance results. As melasma has intrinsic and extrinsic factors to its etiology, we do say that it does have a risk of coming back. Therefore, it is essential that you follow the doctor or therapist's advice, wear SPF sunscreen daily, and if required, obtain the prescription strength depigmentation cream to maintain the results. Most people do not find Pico lasers painful at all. In fact, they are much less painful compared to conventional tattoo removal or pigment removal lasers. They can be, of course, slightly uncomfortable for some people. The Pico lasers are not only just indicated for melasma, they are indeed indicated for other conditions such as freckles, sun damage, as well as tattoo removal. If you suffer from melasma or any other pigmented disorders, we are here to help. You can always book a consultation with me or one of our senior therapists online, and we can chat to you via WhatsApp.